Aerobic exercise is known to have a significant impact on the hormonal responses of the body. The hormones that are primarily affected by aerobic exercise include testosterone, growth hormone, insulin-like growth factor, and cortisol. The changes in plasma concentration of these hormones occur early in exercise, and the hormonal response is influenced by additional factors such as temperature, glucose availability, oxygen tension, and changes in VO2 max. The effect of training on hormone responses is generally an ameliorating one that reflects an increased efficiency of muscular energy metabolism as a result of the training process. In this response, we will explore the hormonal responses to aerobic exercise in more detail, focusing on the latest research findings on this topic. During aerobic exercise, testosterone increases in an intensity-dependent manner, meaning low intensity of exercise elicit little or no response, and maximum or near maximum intensities result in a significant elevation. During prolonged aerobic exercise, testosterone exhibits a biphasic response, provided that the intensity is great enough. Testosterone concentrations increase initially. If the duration of the exercise is long enough, concentrations decrease, which suggests that the decline in its glucose levels may blunt the testosterone response. For example, in an ergometer cycling study comparing the plasma testosterone changes at 3 different intensities, that's high, moderate, and load. In the study, tests A and B consisted of 3 consecutive exercise bouts lasting 6 minutes each of either increasing or a constant workload. In the third group, that's the C group, the subjects perform 2 exercise bouts, each lasting 4.5 minutes with a greater workload of 4.0 watts per kilogram. All the exercise bouts were separated by 1-minute periods of rest. The exercise B protocol, which was a constant low intensity, resulted only in a small increase in plasma noradrenaline concentration. Protocol A, which consisted of a graded intensity, caused an increase in both catecholamine concentrations, whereas the most intensive exercise protocol, which is protocol C, resulted in significant elevations in plasma noradrenaline, adrenaline, and also testosterone concentrations. Overall, significant increases in the serum testosterone concentrations were seen only in the high-intensity exercise group C. In another study of well-trained runners, who underwent a treadmill running exercise protocol with a stepwise increase in intensity. The first 2 steps were an intermittent intensity of 60 and then 75% of VO2 max for 10 minutes each. That's step 1 and step 2 respectively. The last 2 steps were at a higher intensity, and they were at 90% and 100% of VO2 max for 5 minutes and 2 minutes respectively. Total testosterone concentrations increased only after the 5 minutes of exercise at 90% of VO2 max and remain elevated at 100% of VO2 as well, returning to baseline 1 hour into recovery. This data supports the notion that intensity is required to alter plasma testosterone concentrations. Unlike maximal exercise, findings concerning submaximal exercise testosterone responses are somewhat variable and seem dependent on duration and intensity of exercise. In one study, progressive increases in testosterone during exercise lasting 45 to 90 minutes during exercise, which was reported as intense to moderate, whereas another study reported that endurance athletes, which consisted of race walkers and runners, performing during competitions of 60 to 100 minutes duration, experienced only slight elevations in testosterone concentrations. Conversely, 36 kilometers of cross-country skiing or 90 minutes of submaximal stationary cycling in one study produced no change or slight decreases in testosterone concentrations. For running exercise, it's been reported that submaximal, that's at 76% of VO2 max exercise until exhaustion, resulted in suppressed testosterone concentrations. And similarly, marathon running, that's competitive and non-competitive, has also been shown to produce significant reductions in testosterone. Furthermore, endurance athletes competing in even longer running events, that's greater than 100 kilometers, and combination events such as triathlons, have also shown testosterone reductions comparable to those associated with marathon running. Long-term endurance training has often been associated with lower concentrations of testosterone, but this may be simply due to the effects of the large volumes of training reported for these individuals. Generally, it could be said that testosterone is inversely related to the training stress, where once the training stress increases, the testosterone levels will decrease. With respect to aerobic training, studies have demonstrated that endurance athletes have lower testosterone levels when compared to sedentary individuals. However, it has been reported that although testosterone levels were indeed lower in elderly male runners compared to aged matched sedentary subjects, the same was not true for previously sedentary subjects who performed aerobic training for 20 weeks, 3 times per week, with an intensity of 50 to 65% of aerobic power. Another study demonstrated a significant reduction in free testosterone in elderly men following 12 weeks of aerobic training on a cycle ergometer 3 times a week, with intensities varying between 55 and 85% of aerobic power. Possible discrepancies between the results of different studies may reflect the different intensities and volumes used. Interestingly, some studies have even shown that chronic endurance exercise can correlate inversely with basal serum testosterone concentrations. If we look at the gender differences, instead of testosterone, which is typically the primary sex-related hormone of interest, in females, progesterone and estrogens are of particular interest. As with testosterone, these hormones increase somewhat in an intensity-dependent manner. The phase of the menstrual cycle and energy balance can influence the acute and chronic responses. Plus, it is important to note that the use of hormonally based oral contraceptives can alter these responses. Given these factors, it is hard to determine the sole effects of endurance exercise on sex-related hormones. Similar to testosterone, during aerobic exercise, cortisol increases mostly in an intensity-dependent manner. Hence, at very low intensities, cortisol is not increased and may actually decrease slightly due to the very low stress on the metabolic systems at these intensities. As seen in this figure, intensities greater than 50% of VO2 max have shown to result in elevations of cortisol due to the energy requirements needed to perform at these levels. A similar response is observed for prolonged aerobic exercise, with elevations in cortisol levels occurring as the duration of the exercise increases. The long-term training response to endurance exercise includes lower cortisol concentrations, and these reflect the body's ability to utilize the energy substrate available in a more efficient manner. However, no long-term differences and transient increases have been reported. Short-term high-intensity training may temporarily increase resting levels, but as with testosterone, this may be indicative of the nature of the training stresses. Because of the extremely high volumes of training that endurance athletes often perform, the T to C ratio is often depressed amongst endurance athletes. This does not have to be the case, however, since this ratio can rebound when the training volume is reduced. Since growth hormone is closely tied to energy availability, circulating concentrations are positively related to exercise intensity and are highly correlated with lactate response. During aerobic exercise, completed at maximal intensities, very large increases in growth hormone concentrations can be observed. As seen in this figure here, the levels of growth hormones increase with increasing durations of aerobic exercise. Little data exists in describing the chronic resting adaptations of growth hormone to endurance exercise, but it appears that chronic training has no effect on resting growth hormone concentrations. Women do exhibit higher resting concentrations versus their male counterparts, but this occurs regardless of their training status. During exercise, long-term training results in a less of an acute response to a given submaximal workload, which appears to be the result of a more efficient metabolic system in trained individuals. However, maximal exercise efforts result in a greater growth hormone response in trained individuals. Few studies exist that have evaluated gender differences in growth hormone in response to endurance training. However, a prior study in trained endurance runners reported that growth hormone concentrations increased in men, but not in women, after prolonged moderate intensity running. Conversely, other studies have reported no differences. For IGF-1, there's been a mixture of results here: increases, decreases, and no changes in IGF-1 concentrations during exercise have been reported. Yet the majority of the studies suggest a transient increase in an intensity-dependent fashion, but then a return to resting values occurs within 30 minutes of exercise. Exercising IGF-1 levels are not under the control of growth hormone, and increases may be due to the release of a muscle isoform of IGF-1. Another important thing to note here is that IGF-1 is highly dependent on nutritional status, and this may account for the disparate results. Chronic training produces a biphasic response of IGF-1, decreasing in the initial few weeks of training, followed by an increase that is above pre-training values. In addition, cross-sectional studies have suggested that IGF-1 is highly correlated with VO2 max values, which may suggest that this is a possible biomarker for fitness status. However, the completion of more research studies is needed concerning the role that IGF-1 may play in endurance training adaptations. Similar to growth hormone responses, gender differences in IGF-1 response to endurance exercise are conflicting, with few differences being reported.